One of Maine's largest hospitals says it will determine day to day whether it can admit trauma patients or send them to other hospitals for further treatment. Good evening. I'm Pat Callahan.
And I'm Amanda Hill in for Cindy Williams. This all started with a message posted on the website of Central Maine Medical Center, and it now has people asking, what's going on at CMMC? News Center Maine's Sam Rogers is outside the hospital in Lewiston with more. Hi, Sam.
Amanda and Pat, CMMC says this is because of staffing shortages. Until further notice, pediatric and trauma patients will be screened here at the emergency department and moved to another hospital for care if necessary. CMMC says it has been in contact with area hospitals and is coordinating with emergency medical services and Life Flight of Maine to move patients. Local lawmakers say the hospital reached out to them last week asking for help to ask the governor to amend her vaccine mandate.
They started off with just saying, help, we're in trouble, more or less, in my opinion.
It wasn't a shock. I should say I was expecting it based upon everything that the city is dealing with the vaccine mandates within our own EMS divisions.
Auburn Mayor Jason Levesque and Senate Republican leader Jeff Timberlake are concerned for local residents after learning of Central Maine Medical Center's unprecedented healthcare workforce shortages. The hospital announced Tuesday admissions for pediatric patients are suspended until further notice, and the ability to admit trauma patients will be re-evaluated every 24 hours.
I thought it was very concerning to me when they announced that.
Timberlake says CMMC leaders asked him and other lawmakers last week if they can convince Governor Mills to update her vaccine mandate, which is set to be enforced on October 29th.
I just think that if we can do testing and we can make sure that these people that are coming to work are not I think it's a solution to a problem.
Testing is the focal point of this letter signed by Timberlake and other Republican leaders and sent to the governor Tuesday afternoon. It asks Mills to allow unvaccinated healthcare workers to follow strict testing requirements.
And I hope that we could find some bipartisan support in finding a solution to this problem. The governor could easily just say, okay, I'm going to change my mandate and allow for testing.
In the meantime, people still need treatment.
We have been extremely busy.
Dr. Norm Dinerman is the medical director of the Integrated Transfer Center at Northern Light. He says healthcare systems in the state saw this staffing shortage coming and are working together to get through it.
We certainly have what I would call a crisis of dispersion, if you will, right now.
And just a short time ago, Governor Janet Mills rejected that proposal that asked for an amendment to the vaccine mandate. And she says Republicans in Maine have done little to advance the state's response to COVID-19. Throughout this pandemic, they have opposed nearly every public health measure proven to limit the spread of this dangerous and deadly virus. Now, as and Republicans want to weaken a requirement that healthcare workers protect people in their care by getting vaccinated against COVID-19 the same way they have to get vaccinated against other infectious diseases. Governor Mills goes on to say the state will do all it can to confront this workforce shortage, not just here at CMMC, but across the state. Pat?
Sam Rogers in Lewiston tonight, along with some motorcycles. Thank you.